New information tonight. The CDC says more than 107,000 Americans died from drug overdoses in 2021, setting a record. That translates to one overdose death every 5 minutes. And it's a 15% increase from the previous record set in 2020. Well, now a bill is heading to Governor Gov Lee's desk that would expand access to an overdose reversal drug in Tennessee. News 2's Chelsea Bimfor joins us live from the outside of the state capitol to explain the parameters on this for us. Chelsea.
Alex, House Bill 2228 is just awaiting the governor's signature now, but if it's signed into law, it would require pharmacists to co-prescribe naloxone to people that are also taking prescription opioids. This could be a potentially life-saving measure in the event of an unexpected overdose.
We are seeing such an increase in overdose deaths that it is alarming on so many levels.
Across Tennessee, opioid addiction and deaths are rising.
This problem, unfortunately, is getting a lot worse, and the rise of fentanyl.
Elliot Pinsley is the CEO of the Behavioral Health Foundation in Nashville. He says in 2020, our state saw about 3,000 drug overdose deaths. In 2021, almost 4,000. But a new piece of legislation is aiming to help combat those high numbers.
This law would require that they offer a prescription for naloxone so that they could fill that at the same time at the pharmacy and have that at home.
House Bill 2228 would require pharmacists who dispense opioid prescriptions to patients to simultaneously offer a prescription for naloxone. That's the drug known for helping reverse the effects of an opioid overdose.
The more people who have access to naloxone, the better, because we know that 4 or so out of every 5 overdose deaths in the United States and in Tennessee are related to opioids.
The co-prescribing measure would help protect at-risk patients from accidental overdose, such as those with an OD history, those prescribed more than a 3-day supply of an opioid medication, or those prescribed benzodiazepine concurrently. The naloxone would also be on hand in the event that someone other than the patient gained access to the opiates.
Naloxone is a proven tool that we know saves lives, and we need to get it out there in the community more. We need to educate more people about what it is, what it does, and that anyone can use it. It's really not complicated.
Tennessee Speaker of the House Cameron Sexton signed the bill last week. It is now just awaiting the governor's approval. Reporting live from the state capitol, Chelsea Bimfor, News 2.